Hello, my name is Leah Kay, and this is for my Psych 210 course. This is my Adolescence assignment essay. First, we're going to look at the abstract, and that's physical and cognitive changes are brought on by puberty, hence the adolescent stage of life. Puberty brings on a cascade of hormonal emotions and physical changes. These changes help develop sexual maturation. Both males and females go through changes as they start to mature. Erikson said that the primary focus of adolescence is to establish their identity. Self-conception and self-esteem are crucial during this stage of life. There are a couple key words, and that is cognitive changes, reproduction, and identity. Okay. As the body continues to develop and mature out of a child's body, obvious physical and cognitive developments are brought about, hence puberty begins. The beginning of adolescent years begins around the age of 12 to 18. This is a transitional period between childhood and adulthood. This can be simplified as a start of sexual maturity and ending when an adult reaches an independent status. The thalamus and the HPA axis initiates puberty. The hypothalamus pituitary adrenal axis is the process of adrenarche. This maintains physiological homeostasis, which helps with triggering adrenal androgens to activate puberty. The thalamus helps regulate sensory and motor signals. This helps with cognitive development throughout puberty. Puberty brings on a cascade of a roller coaster of emotions as well as sexual maturation from physical and cognitive changes. Puberty is typically a 2-year-long period in which sexual maturation is developing. Males usually start this process at the age of 13, and females generally start at the age of 11. However, not everyone starts at those distinct ages. Whenever a male first ejaculates at age 14, and when a female first has her menstrual cycle, starts the process at ages 12 to 13. Physical changes includes two main things. There are primary and secondary characteristics that influence reproduction. The development of our reproductive organs or the parts of our body that are used for reproduction are part of the primary characteristics. Males have testes as females have ovaries. Secondary characteristics are non-reproductive sex characteristics. Males start developing body hairs and their voices typically get deeper. Females seem to have bigger breasts and hips. Similarly, both genders develop underarm and pubic hair. Puberty does not always start at the same time as mentioned before, but the sequence stays the same. Depending on height, weight, nutrition can factor in when these changes begin. Physically, males who go through puberty earlier tend to be stronger or taller, which can lead to popularity amongst peers. As positive as that sounds, there are negative factors. If a male goes through puberty earlier, they might use alcohol earlier or exhibit delinquent behaviors. Females just tend to tease or experience sexual harassment at an earlier age. Both sexes experience rapid growth in height and weight as they gain 50% of their adult body weight. These physical and cognitive changes leading to sexual maturation does have a huge impact on the way adults see themselves. Late bloomers, males or females, sometimes feel self-conscious since they lack physical developments. Females may turn to substance abuse or even start sexual behaviors earlier. Late maturing males tend to have a higher risk of depression and are bullied more than others. I don't know if I'm saying that right, but he formed the term formal operational thought as the stage of cognitive development. His main idea is that at this stage, the capacity to think of possibility must be reached and not just reality. Deductive reasoning leads to hypothetical thinking. This is explained as the idea that someone can plan while seeing the consequences of an action and provide other explanations of events that could take place. Hypothetical deductive reasoning in school and daily life is influenced by cognitive changes. As adolescents enter their high school experience, they continue to develop cognitively. Teenagers think abstractly, analytically, hypothetically, and logically. During this time, adolescents are trying to figure out who they are and who they are surrounding themselves with. Their peer interaction is important. If they hang around bad influence, then they typically do not go down the right route. They must find themselves in early adolescence. Cognitive developments result in greater self-awareness. The primary focus of adolescence is to establish their identity, according to Erikson. It is important to establish an identity since it has deep relations to self-conception and even self-esteem. Erik Erikson said that life's fifth psychosocial task is one of identity versus role confusion when adolescents must work through the complexities of finding one's own identity. Erik Erikson proposed two main questions regarding adolescence, and those are, who am I and who do I want to be? Adolescents define themselves based on their values, thoughts, and opinions. When adolescents form an identity, this is an indicator of successfully fulfilling their fifth psychosocial task. Self-esteem is explained as the thoughts or feelings about one's own self-conception and identity. Self-conception is explained as the ability of a person to have opinions and beliefs that are defined with stability. Self-esteem and self-conception intertwine with a person's identity and how they view themselves. If a person has low self-esteem, then they are very unlikely to believe that they can confidently be capable. Maria believes the identity should be established by involving both decision points and commitments with respect to ideologies and occupation. These ideologies can be religion and or politics. When a person commits to an identity without exploring the rest, they're experiencing foreclosure. When a person tries to venture out and explore different identities without committing themselves to one is an example of moratorium. Diffusion occurs when there is no commitment nor exploration. Achievement is the final goal. Identity achievers have explored different options, discovered their purpose, and ultimately committed to an identity. Typically, when adolescents have advanced cognitive development and maturity, they tend to resolve identity issues more easily than peers who are less cognitively developed. There are different stages, different areas that developmentalists believe make up an identity. There are 5 stages: religious, political, vocational, ethnic, and gender identity. When thinking about religious identity, most teens question ideas that belong to their parents' practice, but they do follow them. Political beliefs are also typically influenced by their parents' views. Adolescents, however, tend to reflect the Liberal Party on social issues. When teenagers mature into adults and apply for a job, they typically do not stay in the occupation they worked in when they were a teen. This is an example of vocational identity. Ethnic identity refers to people coming to terms with their racial ancestry or ethnical background. Lastly, gender identity is apparently something that people must find to complete their identity. Sex is referred to as the biological differences between males and females. Gender refers to the socially constructed characteristics of women and men. Apparently, if people feel as if they're genetically assigned sex does not match up with their gender identity, then they may refer to something other than man or woman. They might refer to themselves as transgender, non-binary, or gender non-conforming. During adolescent years, sex and gender are uncertain for some, and they find it difficult to achieve an identity or even self-acceptance. That is my presentation on my adolescence assignment essay. Thank you.